There you go, folks. Negative endoscopy. So many people deal with this and they're frustrated. And then what did the doctor send you home with?
And she's like, you're basically fine. Take these antacids and see me in 2 weeks. And it was a meprazole. And I'm not going to take meprazole.
Hello, folks. If you have a hiatal hernia, you're going to want to watch this. We've got Al here who found us on YouTube, who lives here in New York City and has a hiatal hernia, has all the symptoms. Why don't you tell everybody what your symptoms were?
Severe acid reflux, anxiety, which actually got better after the first session.
We'll talk about that in a second, but what are the initial symptoms that you had from hiatal hernia?
Shortness of breath, burning in the chest, and the acid reflux was just horrible.
And you can see he's skinny. He's underweight. Have you lost weight?
Yeah, I've lost weight just because I've had to cut down on the meals and the portions because of the acid reflux.
And the other thing I want to note is he has tried everything, like gluten-free diets, dairy-free, grain-free, paleo, carnivore diet. I mean, you name it, he's done it all, right? And he's vegan now for the last few months. Since he's cleaned up his diet and just gone to like whole foods, fruits, vegetables, foods that come out of the ground that way. Even grains are sometimes okay, some of them for you.
I don't eat grains. Grains give me inflammation. I've been grain-free for years now.
So similar to a paleo diet, but he still has a lot of these other symptoms that haven't gone away, and that's because he has a hiatal hernia. And earlier today, he got an endoscopy.
Yeah, endoscopy showed that everything was fine. They didn't see a hernia. They still have to test for H. pylori, but they were basically saying that everything looks fine.
I'm sure that H. pylori test will come back negative, but there you go, folks. Negative endoscopy. So many people deal with this and they're frustrated. And then what did the doctor send you home with?
And she's like, you're basically fine. Take these antacids and see me in 2 weeks. And it was a meprazole. And I'm not going to take meprazole. I've taken it in the past. Trust me, guys, it just makes it worse. It'll make your digestion worse. It's not a fix.
For some people, it makes it a little better, but for a lot of people, it makes it worse. It's not fixing the issue. And we won't go into all the issues of acid reflux right here, right now, but this is a typical case of hiatal hernia. And we treated him once 3 days ago. What's today?
2 days ago.
2 days ago, sorry. I just got back from vacation, folks. Sorry about that. Yeah. So 2 days ago, and what have you seen so far?
It was better. It's actually the first meal I had after I came to do the treatment was the easiest meal to digest in the last week. The burning was minimal. Right now, I actually just took a meal, and the acid reflux isn't as bad as before. In fact, it's probably a little better with food than it was without food before. So I feel like there was maybe about 20%, 20% improvement from last time.
20 to 25% improvement?
Yeah.
Okay, and that's only one treatment. There you go. If you haven't tried the hiatal hernia maneuver, you need to. All right, let's go ahead, and we adjusted his thoracic spine already. We're going to check his neck, and then we adjusted his lower back as well today. He has some misalignments as well in the hips and the spine, the mid-thoracic. Mid-thoracic spine is associated with hiatal hernia due to posture. Nerve supply comes from there to the diaphragm, to the stomach as well, and the intestines. Turnover on your back. We have a lot of people asking, and people live all over the world, all over the country. It's really hard for me. We have some people in other parts of the country, but you can always schedule a telehealth visit with me, and you get one-on-one 15-minute telehealth visit with me, and we can try to find you someone where you live to have this done. And if not, we can find other resources for you. And relax your head here. Okay, you feel that right there?
Yeah, let's go on this side.
Do you get headaches?
Yeah, I do get headaches.
His atlas, the top bone in the neck, is out. He does get some headaches, and relax here. Good. And relax here. Feel that? Much better, right?
There was a point last year I had a headache for 2 months straight that didn't go away.
Okay, well, next time that happens, come in here right away. If you get a headache, it's a tension headache, okay? I just corrected C1 and C2 for you, okay? Go ahead, slide your shirt up a little bit. We're going to show you the hiatal hernia maneuver. If you've had surgery for your hiatal hernia, you can't do this. Sorry. Now, he's thin, so we're going to go right up to the xiphoid process where the ribs come together, then just off to the center, just left to the center. Put my thumb in there. And a lot of people have tried doing this on their own. It's very difficult to get the angle and the depth and breathe in and out. So what I'm trying to do is get under that rib as much as I can, and then scoop that stomach, scoop it, grab it, scoop it down out of the hiatus, and keep pulling it all the way down. And then I release at the belly button. And with each inhalation and exhalation, I'm going to go a little deeper. I don't do this fast or quick. This is a slow motion. There are some contraindications to having this done. Like I said, having hiatal hernia surgery or stomach surgery, lap band surgery. Be very gentle if somebody's had like open heart surgery. And you definitely don't want to do this if you have an abdominal aortic aneurysm. And he asked earlier if he should do this before or after he eats. It's easier if you wait and eat after, because now we're going to pull the stomach down and his food's going to go down easier, right? So I would not go and, eat a pasta meal and have this done. Definitely don't do that. Give it at least 4 hours to digest before you have the maneuver done. No Coney Island hot dog eating contests before this is done. Okay, deep breath in and out. You see here, it's a slow drag. I'm maintaining that consistent pressure, but it's that slow drag almost to the belly button. How you doing there?
Good.
Good, okay. A little bit uncomfortable, but not as bad the second time as the first time.
No, it's fine. I'm fine.
See, folks, it's not that bad. You've got nothing to lose. The side effects alone of the medication, let alone surgery, we don't have to go into. So this is nothing compared to that. So this is his second visit. We do require 3 visits a week for the first 2 weeks. Then we cut it back to twice a week for 2 more weeks. And then at the end of 4 weeks, we determine, we see how you're doing there. And we also give patient exercises, which we've done videos on that, exercises for hiatal hernia. Those are some of the things we do. We work on posture. We may, if they have a posture issue, so not just strengthening the diaphragm, but improving the posture. It's sort of geared and tailored towards each patient depending on what they need. But pretty much everybody needs exercises to strengthen the diaphragm. So we're gonna do one more here, and I'm gonna try to move my big hand out of the way. And go ahead. All right, I don't want you to come up, in a sit-up position. I want you to roll over to your side and come up from the side lying to that side. You could face the camera there, and then sit up, swing your legs over the edge, and sit upright. Legs over the edge, yep. There you go, you're all set. Thanks for
Thank you so much.
doing a patient testimonial there. This is a real patient, real testimonial. I hope you guys get the help that you need. Your doctor's not gonna tell you about this method, sorry. But you found it here, thank you for tubing in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.